safer on the holidays, like being sick, right? And right now, doctors are warning about a new quadruple health threat. We've got the flu, COVID-19, RSV, and norovirus, and it's got a daunting name to go along with it, the quad-demic. To best protect yourself, you know the drill. Doctors say if you have not done so already, get your COVID and flu vaccines. There's also a shot for RSV for people 75 and older and with certain health conditions. And when it comes to norovirus, sadly, there is no vaccine, so practice good hygiene, lots and lots of hand washing. Dr. Dana Hawkinson is here, Medical Director of Infection and Prevention at the University of Kansas Health System. Welcome to you, Doctor, as always, and happy holidays. We want it to be a healthy one. Are you seeing pockets or hearing about pockets of these illnesses across the country that we need to worry about?
Yeah, hi, Marnie. Thank you so much. Merry Christmas to you. Yeah, we know that in certain areas of the country, they may have more activity of these viruses than others. Unfortunately, what we have seen recently in the last couple weeks are increases in the rates of influenza infection throughout the country, as well as COVID, which had been low after the summer peak. Now it is starting to increase as well. And for norovirus, we're really looking at some of those more less confluent areas. So not all over the nation, but certainly certain areas or certain communities can be hit a little bit harder than others with the norovirus.
I'm usually really diligent about getting my flu shot, and this year it just, to be honest, it slipped my mind. I usually get it in like October, November. Is it too late to get it, or still a good time to protect ourselves?
Absolutely not too late. It's still a good time to go get it. You know, you want 10 to 14 days to really build up the immunity after vaccination. We know that obviously influenza rates are increasing, as we said, but you still have time to go get it. It will still offer protection. So would advise everybody who has not gotten their vaccine yet for influenza, which uptake around the nation is about 40%, to go get the influenza vaccine and get the updated COVID vaccine as well if you have not. And I think uptake for that around the nation is about 20%.
Okay, and remind us about RSV and who's most at risk and what those symptoms are.
Yeah, RSV is another one of those respiratory viruses, as we are now in respiratory viral season. It affects the very young, so especially those people or those children that are 1 year or less, and the elderly, so really above 60 and older. And you mentioned certainly it is recommended for everybody 75 and older. There is a consideration with shared decision making with your medical team or your physician if you're 60 and over. I would certainly advise really anybody 60 and over should be able to get it. The first RSV vaccines came out last year. Right now there is only a recommendation for one, so if you received it last year, you do not need to get a updated vaccine at this point in time. But if you didn't receive it, please go get RSV. The RSV vaccine, it can cause significant respiratory problems, lower respiratory tract, meaning in the lungs, pneumonia, which can significantly lead to health problems, having to seek medical treatment or even hospitalization.
Finally, the norovirus, you mentioned this, but there is no vaccine for that. And if you get it, heaven forbid, it is rotten. At what point do you need to go seek medical care? You can no longer tough it out at home.
Yeah, I think that's exactly right. Most people can get through it in 2 to 3 days. If you are going longer than that, or you are having more of the nausea, the vomiting, and the diarrhea, which leads to dehydration, and that's what a lot of people get in trouble with. If you're having significant issues with that, know your body, understand how long you've been sick and how you're feeling, and seek medical attention at that point in time.
All right, for a healthy holiday, clean hands or happy hands, wash often. Dr. Dana Hawkinson, Merry Christmas.